Hello everyone, my name is Gabriella Santillan and today I will be presenting on the Rubella virus. Okay, so facts about the virus itself. This virus is a positive sense, single-stranded RNA virus. It is 40 to 80 nanometers in size and has a spherical shape. It has an electron-dense 30 to 35 nanometer core, is composed of the C protein and the RNA, and its most important quality is that it has the glycoproteins E1 and E2. So these glycoproteins, as you can see in the picture, are kind of like this spike-like shape surrounding the cell itself, and they contain a substance called hemagglutinin. And hemagglutinin, what it does, it's going to adhere to the red blood cells in one's body, and it is going to initiate infection. And keep this term hemagglutinin in mind because the antibody response is going to be directed to this glycoprotein specifically because of that. Okay, as for the taxonomy, Rubella is part of the family Tocaviridae, and this family includes two genera, Alphavirus and Rubivirus. As for the genus Rubivirus, Rubella virus is going to be the only species, and it is limited to a human host, which makes it pretty unique compared to Alphavirus because Alphavirus contains 29 species and is able to transmit its disease in a wide variety of hosts, such as arthropods, amphibians, and mammals, compared to Rubella. Again, it is the only species and is limited to only a human host. Okay, as for the epidemiology, Rubella used to be much more common than how we think of it today. You probably have not heard about this virus. And epidemics used to occur every 6 to 9 years, until the vaccine was developed in 1969 by Maurice Hillman using live Rubella strains. And then 2 years later, in 1971, this vaccine was combined with the measles and the mumps vaccine and was made into the MMR vaccine, which is the vaccine that we use today. Now I have included a couple statistics just so you can see how common it really used to be and how it affected people. So the last epidemic was from 1964 to 1965, and this is how it affected people. So a total of 12.5 million people got infected, 11,000 babies died in the womb, and 2,100 newborns died. And a total of 20,000 babies were born with CRS, meaning congenital Rubella syndrome. And out of all these babies, 11,000 were born deaf, 3,500 were born blind, and 1,800 were intellectually disabled. Now thankfully, because of these vaccines, Rubella was declared eliminated in 2004, and when I say eliminated, I mean that there was no continual transmission of Rubella throughout this geographic area for at least 12 months. And as of today, there are currently less than 10 cases per year in the USA. However, that is unfortunately not the case for the rest of the world because worldwide, there are 100,000 cases of Rubella annually. Okay, and here I have a chart so that you could just see some visuals. After 1969, you can see that dramatic drop of Rubella cases, and there has been a 99% incidence decrease ever since the pre-vaccine era compared to now. Okay, as for pathogenesis, like I said, this disease can only be transmitted from a human to human, so how exactly does that work? So the main way that it's going to be transmitted from one person to another is through airborne respiratory droplets, such as coughing or sneezing near someone, through saliva, such as kissing or sharing a drink, and maternal fetal transmission, which is how a baby develops congenital Rubella syndrome through the blood and through the placenta. Now, the incubation period for Rubella is going to be 17 days with a range of 12 to 23 days. And one of the main ways that you know that someone has Rubella is through this typical rash. And so before this rash appears, someone can be contagious 7 days beforehand and 7 days after, but the period where an infected person is going to be most contagious is that period when that rash appears. And now this virus is going to be the cause of Rubella, also known as 3-day measles or German measles, and congenital Rubella syndrome. Okay, how does Rubella present itself? So first of all, Rubella is going to be most common in children and young adults. The primary symptom of Rubella is going to be a maculopapular rash. Now this rash presents itself in 50 to 80% of infected patients, and that's why it is going to be the primary symptom. Now maculopapular, what does that mean? Macular meaning that there are going to be flat areas of the skin, and papular meaning there's going to be raised areas of the skin. So there's going to be that combination of those raised and flat areas of the skin. And now this rash also appears similar to that one of measles, both are maculopapular, and this one is going to start on the face, on the head, and it's going to spread down to the body. Now, other symptoms of rubella are going to be a mild fever of 102 degrees Fahrenheit or lower, a headache, swollen lymph glands, a runny nose, and inflamed red eyes. So overall, these symptoms are very mild and will only last an average of 3 days. And that is why rubella is also called the 3-day measles. As for these symptoms, only 25 to 50% of people infected actually develop these symptoms, and that's really how mild it is, but rubella is still highly contagious. Okay, now as for congenital rubella syndrome, the situation is going to be much different. As I previously said, this happens when the baby gets the disease in the womb. And so first we have the classic triad, so the 3 main symptoms of CRS. They are going to be deafness, cataracts, and a congenital heart defect, with the most common one being patent ductus arteriosus, which is a condition in which the pulmonary artery and the aorta have an opening at birth when they're supposed to be closed. That connection between them is supposed to be closed. And out of these 3 symptoms, deafness is going to be the most common one. Now, outside of these, there are other symptoms, such as intellectual disabilities or going to the extreme of a miscarriage of the baby. Now, the development of infection is going to depend on the gestational stage. So for the first trimester, the baby has a 40 to 60% risk of developing this infection. So a very high risk of developing CRS. For the second trimester, this risk is going to drop down just a little bit to 30 to 35%. By the third trimester, this risk doesn't decrease completely, but it decreases down to 10%. And so 50 to 90% of infants born to mothers infected with rubella during the first trimester are going to develop CRS. Okay, now how can we diagnose rubella on a patient? So there's a typical rash, as I mentioned, but this is not going to be enough because, like I also said, this rash is going to resemble that one of measles. So how can you differentiate it between rubella and measles? So other lab work is necessary for this. So one thing that we can do is PCR testing from respiratory secretions, because that is where the virus starts, through the presence of the IgM antibody and the IgG antibody. As for the IgM antibody, this is going to be detected by a neutralization test and the hemagglutinin inhibition. As you recall, those glycoproteins on the virus E1 and E2 contain the hemagglutinin. And so if these antibodies were produced in order to respond to that hemagglutinin, you know that a person has been infected with rubella. So for this specific antibody, it is going to rise and peak in the blood within 7 to 10 days after infection, and then it's going to taper off. And this antibody is going to indicate a recent infection. As for the IgG antibody, this is going to stay in the bloodstream for life, providing lifelong immunity, and this is going to indicate both recent or past infection. As for congenital rubella syndrome, it is the same process. It is going to be detected by transplacentally acquired maternal IgG antibody and actively produced fetal IgM antibody. Okay, for the treatment, there is unfortunately no cure for rubella or congenital rubella syndrome. For rubella, this is not that much of a worry because, like I said, the symptoms will only last 3 days, and they usually resolve without complication. Like the most complication that has been recorded is arthritis in women. And for rubella, not that much of a concern that there's no cure. As for congenital rubella syndrome, the only thing that you can do about it is just treat specific symptoms. So what can we do about these diseases? The best treatment is prevention via the measles, mumps, and rubella vaccine, which again was developed in 1969. Now, under CDC guidelines, the first dose is recommended at 12 to 15 months of age, and then the second dose is recommended at 4 to 6 years of age. As for the vaccine, there are usually no side effects, but the most common side effect is going to be fever, as 15% of people develop a fever, followed by a mild rash, followed by joint pain, and then very rarely, 1 in a million people will get a severe allergic reaction, anaphylaxis. It's okay, it's okay. So that is the end of my presentation. And the reason why I chose this virus was because my grandmother had once been exposed to it while she was pregnant with my mother during her first trimester, which, as you now know, is incredibly dangerous for the baby. And once my grandmother went to the doctor recommended that my grandmother terminate the baby. My grandmother said, "No, thank you, absolutely not doing that." And my mother was born perfectly healthy. She never got the virus, and my grandmother never got it either, which was honestly a miracle for the both of them. And that is a picture of my mother as a baby who was really born super healthy. Thank you so much for listening.